Hi, I'm Dan Kenner, and we're back with Dr. James Butler, who's an expert in bioaesthetic dentistry. We've been talking about how lifestyle is as important for dentistry as it is for any other part of the body. We tend to compartmentalize the teeth as being somehow separate from the rest of the body, but Dr. Butler's been enlightening us that there's a link between the two that can't be separated. Now, I'd like to just cover a few issues that a lot of people wonder about, when they think about dental science. What's your feeling about the use of mercury? Is mercury being used as much today as it used to be in amalgam?
Not as much, and there's still a good bit of controversy, but most of the dentists are using other materials just because they're better long term. Silver mercury, the insertion protocol, the way we have to do that is more damaging to the teeth than putting other materials in. So it is an inexpensive material, and that's pretty much the only reason it's still in use. But most of the dentists that I'm aware of are using other materials simply because they look better and they're easier to place. They're less stressful on the teeth. But it's true that I am always surprised at how many of my patients still have multiple silver mercury amalgams in their mouth, in their 40s, in their 50s, in their 60s. So it amazes me.
Now that raises an interesting issue, because if it's more traumatic to do that type of procedure or use that type of material on the tooth, what effect does trauma have on the surrounding teeth or on the whole integrity and health of the mouth?
Well, that's a good question. And it turns out that the failure chain for silver mercury amalgam is the fact that it's not glued in, so it does leak. And usually within 10 years it starts leaking. And as it does, the saliva from the leak combines with the silver mercury to form a sludge layer underneath the filling, which doesn't, when you clean that out, now you have to aggressively take out this sludge layer because nothing will stick to it, and the modern materials are glued in, which is one of the reasons they're better. So you have a lot of internal damage. Even if you think your filling is okay, underneath it could be a lot of damage that won't be uncovered until the enamel, which is super strong material. Human enamel is a marvelous material, and it won't give out until the last straw. So, we think we're doing great, and all of a sudden our tooth breaks, and we think, well, my tooth just now has a problem. Well, it's probably had a problem for 10 or 20 years, but thanks for God-given enamel, it held the tooth together. And now we don't have anything to hold our tooth together, so we generally have worse problems when those type of fillings are allowed to fail.
Right. Now, if there's an acidic mouth, does that make the sludging problem from the amalgam even worse?
Well, it does, because it affects the condition of the very enamel that's trying to hold your tooth together. And it's very damaging to enamel. Stressful lifestyles, tooth grinding, things of that nature on top of old fillings is a recipe for disaster, because your whole bite can change, and so even your jaw joints aren't functioning properly. So we have a lot of issues created with that.
Well, another area of controversy that has been around for a long time is the issue of fluoride. Fluoride's controversial because it's toxic, and there are a lot of communities that sort of force it on everyone because it's in the water supply. What are your thoughts and feelings about the use of fluoride in dentistry?
Well, when I was first in dentistry, everyone agreed that studies showed that the populations that were fluoridated had better teeth than those that weren't. However, that being said, right now in my practice, our focus is on a different form of fluoride that's used topically to help strengthen these root surfaces, and so it's an important weapon for us, and we don't want an abnormal fear of fluoride out there and these safer versions of it, because we have a lot of people that don't want to use topical fluoride, which is proven to be safe and effective.
Okay, so there's fluoride and there's fluoride, and the type that's put in the water supply isn't the same that's used sort of medically and strategically in the dentist's office.
That's correct. Those aren't ingested forms, and they're not the same form that's in the water supply. But they're very well proven to help us strengthen these root surfaces, which is the Achilles heel of the 50 to 80 group.
And another area of controversy is about root canals. What's the lifespan of a root canal? And maybe tell us what a root canal is in the process for some of those 90-year-olds who have perfect teeth who don't know what it is.
Well, a root canal, the good news is your tooth stops hurting if it's infected or damaged. The bad news is that the tissue that they take out is the pulp and the nerve tissue. Mm-hmm. That's why it stops hurting. However, now you have a kind of a hollow pumpkin that starts to dry out, and within 2 years it's only half as strong as it used to be. And it has no natural defense mechanism against cavities and erosion. Mm-hmm. So they're not lasting long enough, I'll tell you that, because most of the teeth that we take out that have been maintained with root canals, that's a lot of the implant dentistry we're doing.
Mm-hmm. Mm-hmm. Well, that is so interesting. Now, one interesting thing that you told me before the show is that sometimes dental implants are a logical choice instead of a root canal. And I'm afraid we're running out of time, but I would really like to have you come back on the show again so that we can talk about implants and implant technology, because I know that you're an expert on that. So hopefully you'll be willing to do that. Maybe you could tell us just right now what an implant is, because I don't know if our audience
Absolutely.
knows.
Well, a dental implant is simply an artificial tooth root that's been designed for the body to grow bone around and become a natural part of the system. So wherever you have an implant, you have a tooth root that happens to be artificial, but it functions much like a tooth root and is actually stronger in most cases. And this is rare in dentistry. Most of the stuff we do actually weakens you. This is the only thing that can strengthen your mouth.
That's wonderful. Well, we're going to have to talk about this again. That's too interesting and too important to ignore. So thank you again. Dr. James Butler here, expert on bioaesthetic dentistry. I'm Dan Kenner. Thanks for joining us.